Now, Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, has announced the rolling out of the second phase of the malaria vaccine implementation program in 51 districts across the 7 regions of Ghana. The program, according to him, is to help cut back on the level of malaria infection in the country. He was speaking at a media briefing under the theme Malaria Vaccine for Additional Protection. There's more in this report.
A child dies every 2 minutes from malaria in Africa. That's according to the latest statistics of the World Health Organization. In Ghana, over 2,000 deaths are recorded annually, with 30% of admissions in hospitals daily. Ghana is among the 15 highest burden malaria countries in the world. The country has been working to reduce the spread of malaria with investments in the health sector. The Ghana Health Service in 2019 introduced the RTS vaccine for children between the ages 6 to 18 months to prevent severe malaria cases among children. So far, over 400,000 children in 42 districts have received doses of the vaccine within the first phase of vaccination. Piloting of the program, according to Dr. Patrick Kuma Abuaje, has now been extended to cover additional 51 districts.
Recent advances in malaria vaccine development have increased the ability to protect young children against infection by one of the parasites causing malaria. The development of the RTS malaria vaccine by GlaxoSmithKline has increased confidence that a safe and efficacious vaccine could contribute to preventing malaria among children. Ladies and gentlemen, in Ghana, 42 districts in 7 out of the 16 administrative regions benefited from the malaria vaccine implementation program since 2019. The planned expansion of the RTS malaria vaccine will cover 93 districts, as I said earlier, across the following 7 regions: Ahafo, Bono East, Central, Oti, Upper East, and Volta. This vaccine expansion will be phased as follows. Phase 1 is involved the 42 vaccine introduction districts which have been successfully completed. So the first phase is to continue in the 42 that we are in. Phase 2 will add an additional 51 districts. Phase 3, expansion to about nationwide up to remaining 168 districts based on the malaria burden and epidemiology, as well as global availability of vaccines from January 2024.
Also speaking at the briefing, Manager for Expanded Program on Immunization at the Ghana Health Service, Dr. Kwame Amponsa-Janu, said the introduction of the malaria vaccine is an additional tool to reduce malaria-related deaths.
The vaccine will be a major first step for malaria control in terms of vaccination, but it will add to the existing interventions for child survival and health equity. The vaccine will sustainably or substantially reduce malaria illness and death if added to the existing interventions. And if implemented broadly, we know that we could save tens of thousands of lives every year.
In an interview with Joy News, he stated that social media misinformation on the efficacy of the vaccine is a major challenge and called on all to refrain from such.
The only challenge we would foresee would probably be the social media misinformation and disinformation that will normally fly on the site. Those are the issues. But for the mothers and for the caregivers, they are already convinced. So, and we are hopeful that with a little education, there wouldn't be any big challenge.
Hetty Ann and Esther Nkrumah's report for Joy News.